Now I'd like to welcome to the show David Clement, the North American Affairs Manager for the Consumer Choice Center. Thanks for joining us, David.
Thank you very much for having me.
So it's only 10:30 a.m. Eastern Time when we're recording this, but I think it's time to talk about alcohol. So we have talked about beverage regulation on the show before, particularly episode 99 with Jarrett Dieterle. So when you're done with this one, if you're still hungry for more, if you're listening, go back and listen to that one. But there's some interesting new movements, I think, certainly in the public health space that might
hmm
impact stuff that our listeners would be interested in. And so you recently reported that the American Medical Association is now endorsing the idea that alcohol beverage containers should have a cancer warning risk on them. So is our beer and wine the new tobacco?
well, some in the public health lobby seem to think it should be, but when you evaluate the data, it doesn't hold even remotely true, and I'll walk you through why. So how I got onto this beat was the an organization called the Canadian Centre for Substance Use and Addiction, the CCSA. They were paid a bunch of money from Health Canada, which is our FDA, to evaluate cancer risk and alcohol. And they came out with what was a heavily criticized report. A lot of people in the academic space argued that they really just cherry picked the data. But I actually went through their risk tables and their data tables, and the cancer risk associated with moderate alcohol consumption for a male, so they looked at 7 types of cancers. We're looking at like 1/100th of a percent increase if you drink less than 2 drinks a day. So in terms of risk, it's a statistical whisper,
Mhm.
right? And a lot of that research, I apologize to the Americans watching, kind of bled into the U.S. conversation. And some of those researchers actually were tapped to advise on some of this in the U.S. But the problem is that it is just such a tiny increase in risk that putting cancer warnings on alcohol would just be unnecessary fear mongering because
Mhm.
and and this is the debate that I've had with policymakers on both sides. It's like, well, are you going to put the absolute risk on the bottle and
Mhm.
say what it is, right? It increases your risk of a particular cancer by 0.002%. I mean, that's nothing,
Mhm.
especially in the context of where we're maybe more familiar with cancer warnings, right? If you look at cigarettes, I mean, I think that's like a 2,400% increase in cancer risk if you're a regular smoker.
Mhm.
So to equate alcohol with tobacco, at least in terms of what consumers view, would be a huge mistake in my mind.
Well, yeah, it seems if because the argument here is always that well, we want to provide consumers with more information so they can make smart choices for themselves, etc.
hmm
And but it seems like you're providing so little information that you're actually
Yeah.
misleading them, because, like you said, if you found a way to have like the incremental risk, say it's like zero point 0.1 or zero point 0.02 or 5 or 10 or 20% or whatever it is, people could sort of compare that, even though they have to be statisticians to understand a bigger number is a more hazard than a smaller number,
hmm
because we don't, like in the United States, we have the sort of FDA, USDA nutrition labels on the sides of things. Like, here's a can of soda. Here's the little
hmm
box with it doesn't say contains calories or doesn't contain calories. Like, it tells you the exact number of calories, right?
Yeah.
So if the so having the like potentially a can, cancer hazard, not a cancer hazard, would be the like food equivalent of saying has calories, doesn't have calories. Like, in order to like actually
Yeah.
make decisions, we need more information than that, not less.
Yeah. And there's an important distinction here between hazard and risk, right? Hazard is something could harm you. Risk is the probability of it harming you based on your exposure. And this is one of the big communication problems that we see on alcohol. So, like the WHO and groups like Movendi, which are neo-temperance organizations, will say there's no safe level of alcohol. It's like, well, I mean, technically there's no safe level of driving or swimming
Hmm.
or of intimate relations with others, right? Everything has risks. It depends on your exposure and the circumstances. And so it just really makes me scratch my head when they try and take public health rules and regulations from other industries and apply it to alcohol when it really just doesn't fit. And then it also begs the question of, okay, if you're going to put the risks, are you also going to put the benefits?
Hmm.
Right? There's an inconvenient fact for the anti-alcohol lobby that people who drink moderately, again, 1 to 2 drinks per day, have an all-cause mortality rate that's actually lower than people who don't drink at all. And I mean, I'm not saying that to encourage people who don't drink to drink, but it is something that's borne out in peer-reviewed research going back to the 80s all the way through to just a couple years ago. So are we putting the benefits on the bottle? Is what like do we really want to get into that type of we have to put everything possible on the bottle?
Hmm.
And that seems to be a bit of an inconvenient truth that the people who disagree with me can't seem to get their heads around.
Well, yeah, and obviously research, the contours of research changes over time, and then but the sort of government process by which official like labels are approved and revised is generally slower and clunkier than the progress of sort of incremental change in the medical literature. So it seems like you would always, even if you did somehow include, both advantages and disadvantages to the health prospects of, using any of these substances, that process would always lag behind whatever the latest research was anyway. And so you would
Yeah.
be almost guaranteeing uh, out of date warning labels.
Well,
Uh,
and you also run the risk of creating warning fatigue for consumers, which is what you see in California, right?
mm-hmm.
Where everything that in the production process that touched a carcinogen has a cancer warning. Like your lawnmower, if you buy it in California, has a cancer warning on it. I bought cowboy boots in Nashville that are also sold in California that came with this California tag that's explained that carcinogens were involved in the production of making those cowboy boots. Is there a cancer risk to wearing cowboy boots? No, I'm not eating the boots. Um, but when you go so wide and so far, you create fatigue, and then people really just don't care and don't understand risk. Now, I will say there has been some positive development. There are reports now from Reuters that DC is looking to change how they communicate what moderation is for American consumers, rather basically shifting away from if you're a male 1 to 2 drinks per day to just drink in moderation, which for me is actually a really refreshing pivot from what is otherwise a very paternalistic approach. And I also think that it's beneficial because 1 to 2 drinks is not taking into account the fact that people have different body types, people have different comfortability with alcohol. They may have complicated family history that would suggest that they avoid alcohol altogether. There's differences between men and women, tolerance, all of those things. And so when I saw those reports come out, I was like, oh, finally we have some adult conversation that's like, yes, moderation is good, and we generally trust you to figure out what moderation is. And I would love to see more of that across the board, that is kind of broader and more general, and leaving it to adults to kind of manage what the decision making process looks like there.
Mm-hmm.
We'll see if that ends up getting confirmed, but that would be a big step forward just in terms of pushing back against that really paternalistic attitude we see in public health, where every problem has a government solution and they'll use as whatever weight they have to try and fix it. And
Mm-hmm.
that just creates a whole list of externalities. And I mean, you see that in every industry.
Right. Um, and so I wonder where this sort of heavy emphasis on the risks of alcohol versus other things seems to be coming from. Because certainly I have things, even though I don't write about this or think about this full time like you do, but I've certainly seen more of these sort of problematizing of alcohol that, like you said, there's no safe consumption level. Like that's
Hmm.
the new sort of like public health advocacy way of talking about this. Everyone should just be a comprehensive teetotaler, and the idea to sort of pathologizing alcohol consumption at all. And I wonder why is there such a focus on this versus like any number of other things that might be good for your health, right? There's certainly people who are heavy drinkers who would be better if they drank less, but uh, surely eating a high fiber diet will do more to lower your colon cancer risk than going from drinking one beer a day to drinking zero.
Yeah.
Yet,
Well,
I don't.
why is this the new trend? So my theory on this is, I mean, smoking rates are now down to historical lows. There's a variety of reasons for that: vaping, nicotine pouches, awareness, knowledge, etc. And so a lot of the academics, the researchers, and the NGOs who spent decades in that war need to find something else to work on to justify their existence, to justify their jobs, to keep money coming from various government agencies flowing in. And so you see a lot of this happen sometimes gradually, but sometimes rather quickly, where they just pivot and take the same model that they applied to something else. And that right now they're focused on alcohol. And that's where I like the WHO or other organizations, Health Canada, FDA, you see them pivot to the new crisis, whatever that may be. In this case, it's alcohol, applying the same methods and tactics. And for me, it just seems like an attempt to keep themselves busy to justify the jobs that they have. And that is a problem because they've with the alcohol example, it's just not valid. It's not applicable. You're comparing you're, you're comparing uh, driving a Ferrari versus driving the speed limit through a school zone in terms of risk,
Mhm.
and yet they they view every problem as fixable. They have the hammer, and every problem is a nail, and they can fix it with the hammer.
Well, yeah, I guess if your whole view of public health and even public policy in general is via this sort of paternalistic way of like more heavily regulating consumer choices, then you're not, there's going to be, most people are not going to have a natural stopping point to that. That's just going to be the way they look at problems in general. Uh,
Hmm.
so it's interesting if you go back, say, like 100 years, um, uh, back when we thought alcohol prohibition, outright prohibition was a good idea. I remember my old boss, Fred Smith, used to have on his wall of his office a uh, like editorial cartoon from right before the Prohibition Amendment was passed in the late 19 teens, and it was featured these sort of cartoon characters, and one was a whiskey jug, and he had sort of a face and arms and legs, and he was being led away in handcuffs by the Women's Christian Temperance Union, one of the big anti-alcohol activist groups at the time. And so he's being arrested because prohibition's coming in. And then he sees these other guys standing off on the side and they're pointing and laughing at him. And one of them is a cigar, one of them
Hmm.
is a chocolate sundae, and one of them is a stick of gum. And he looks at them and he says, "You shouldn't be also all fired cocky. You know, they'll be coming for you next." And
Yeah.
so that was sort of like the nanny state version of the time, which is, they went after alcohol first and then they're going to go after tobacco next. And now 100 years later, we're sort of in reverse, right? We
Hmm.
had decades of anti-alcohol activism or anti-tobacco activism, and now it's being applied to alcohol. But it's a
Hmm.
sort of the underlying view of the government should control your access to substances kind of hasn't changed.
Yeah. Well, it's interesting you bring up the prohibitionists because those people, most people don't know this. Those people still exist. So there's an organization called Movendi now. They used to be called the International Order of Good Templars, which was a huge prohibitionist group. They rebranded, I think maybe because they thought the Order of Good Templars sounded a little bit too much like a Dan Brown novel. Um, but Movendi is a very influential group with the WHO, with national health agencies, their researchers who are their affiliated researchers, the ones who published that report in Canada, are like these are hardcore teetotalers, and I have no issue with people who choose to live that way for themselves. But and this was the example I used in Canada, which I thought was kind of funny. Um, it would the way in which it operated in Canada, and this is how I view when governments collaborate with groups like Movendi. It's like tasking people for the ethical treatment of animals to come up with the guidelines on meat consumption.
Mm,
The
right.
answer for them is zero because that's their viewpoint. And they're totally fine to have that viewpoint, but let's not try and mask this as some academic scientific process um, that has validity in that way. And that is the problem of having these prohibitionists. Yes, they've renamed themselves, but they still exist and they actually still have influence. And that's a big problem.
And well, that also kind of suggests to go back to the sort of like relative risk of health problems, cancer and things like that. If you look at uh, what, say, like the UN or some other public health groups have warnings they've tried to put out, and they said, well, a lot of things have associated cancer risk, um, including things like consuming red meat, right?
Mm-hmm.
Like that's on one of the tiers of like World Health Organization, cancer risk, and so we're sort of promoting sort of issue by issue. Oh, this is dangerous. That's dangerous. This other thing is dangerous, without, I think, one, comparing the relative risk, or making people realize that, like, well, actually, a lot of other very common things are also on this supposed list of some
Mm-hmm.
risk. Um, but when they're used to a sort of safe, unsafe binary, and
Mm-hmm.
so when they hear, oh, well, this thing is all of a sudden on the unsafe list. It's like, well, but like probably half the products in your home are on the unsafe list. So let's not
Yeah.
sort of jump. Uh, but but again, presumably, people who are working on behalf of PETA are more than happy to waive that report that says, look, it says red meat is a cancer risk. Everyone should be a vegetarian.
Yeah. Yeah. I mean, I had this conversation in Canada, and I'm sure it will happen in the United States in terms of cancer warnings on alcohol, right? If that's the new threshold, because one of the common talking points was about women and breast cancer and alcohol consumption, which is predominantly driven by heavy drinking. Because heavy drinking, again, the exposure rate is significantly higher. It's the heavy drinkers who account for the vast majority of alcohol-related cancers. But if the threshold is alcohol now, well, I mean that includes a lot of things like oral contraception. And I remember asking this question to to somebody who supported cancer warnings on alcohol and saying, what would the consequence of cancer warnings on oral contraception for women be? And their response was, oh, well, that might unnecessarily discourage them from considering that. I'm like, well, unnecessarily is the key word here, right? So you've
Right.
established the potential consequences of overdoing it. This is an example of where you're overdoing it.
I think you make a really good point about the again, it's not just a question of people who drink versus people who don't drink. It's the amount over time that people drink, and
Mm-hmm.
the heavy drinkers constitute overwhelming majority of health problems associated with alcohol. So I looked up this like distribution, and the numbers I was looking at are a few years old, but I think the overall landscape is pretty similar. So
Mm-hmm.
if you imagine a chart where you have we're divided up into deciles. So 10% of the people, the next 10%, the next 10%. If you look at the left-hand side, so the people who drink the least, the first three deciles, the first 30%, people don't drink at all. The next three deciles drink less than like one drink a week. So that's
Hmm.
60% of the population already. And you have to get all the way to the end, the 10% of people who drink the most, and they drink like 74 drinks a week.
Yeah.
Right? That's like 10 drinks a day.
Yeah.
But in a country of 330 million people, like in the United States anyway, that's a lot of people. The 10% of the population is still a lot of people. So that, I don't know what the exact number, but the 10% of people who drink those 74 drinks a week on average have to constitute the overwhelming majority of negative health consequences.
Yep.
And
Well, negative health consequences and all of the other potential negatives of alcohol consumption, driving while impaired, motor vehicle accidents, accidental injury, right? You would have that sliver of drinkers be almost all of the negative outcomes associated with alcohol. And yet, from a public health perspective, rather than trying to focus on those who are problematic drinkers, I mean, if you're drinking 70 drinks a week, you are definitely a problematic drinker. Um, Rather than focus on them, they want to use this kind of very fear mongery scare tactics and apply it to everybody, despite
Mhm.
the fact that almost everybody doesn't fall into that bucket. And I think it could probably be argued that if you're consuming 70 drinks a week, you don't really care what's on the bottle, label wise. Like you could put whatever you want
Mm.
that would be as scary and fear mongering. It's probably not going to make a difference. And so there has to be a better way to help those people that doesn't treat the rest of the population as if they're children and communicate a false message.
Mhm. So So here's a sort of bigger cultural issue, when it comes because we've already been kind of comparing the contours of tobacco control and alcohol control. So, when it comes to various, what people consider vices, or it's, smoking or drinking or recreate other sort of recreational drugs like marijuana.
Mm-hmm.
So the common reason for, for formal legal restrictions is to, protect the public health and minimize disease. That's sort of the nanny state, reason to save you from yourself. But it seems like some cases, where we can, promote health and minimize disease, like encouraging people who smoke to switch to vaping or switch to a product like Zyn or something, which has a
Mm-hmm.
lower risk profile. That a lot of those same people, the same like public health activist people, they oppose that too, right?
Yep.
And so it makes me wonder, is there just a Puritan hatred of pleasure that
Yeah,
that
it's about control. It's about control. I mean, in the AMA statement on cancer warnings suggested extending the cancer warnings to non-alcoholic beer. Think about that for a second, right? We've seen this in Europe where there have been heavy campaigns to actually limit access to non-alcoholic beers. And it's like, yeah, but non-alcoholic beer is like the zin of alcohol consumption.
Mm,
Would it be better if someone who was drinking 70 drinks a week cut that in half and replaced it with non-alcoholic drinks that taste the same?
mhm,
Yeah, that would be great. That would be fantastic. I'm not really personally a fan of non-alcoholic
mhm,
beers, but if it works for people, that's fantastic. And so, yeah, I think it just comes down to this very puritanical view that, like, no, the solution to this problem has to be something that we can control, and they're very resistant to market-based or innovative solutions that solve some of these problems. Like you mentioned, vaping, Xan, etc., non-alcoholic beer, right? These are all market-driven solutions to public health problems that should be embraced, not overly regulated and not shamed.
yeah, I wonder how the international cultural differences here are sort of playing into this because some of these, I feel like the world of public health professionals is a pretty kind of international thing where a lot of the same people, they read the same journal articles and they go to the same conferences, and there are, of course, like the World Health Organization, international organizations meant to go across boundaries. But obviously, there's cultural, political differences in each country that you
Mhm.
know, uh, kind of limit or incentivize people to adopt policies that are more or less aggressive. So, how has this been playing out for, you could compare the US and Canada, two of the two most similar countries, really, but then also, are there examples from what's going on in, say, the EU or Australia, or Japan, or wherever else, this sort of like developed countries with well, big public health budgets? How is the sort of the health risk of alcohol issue been playing out internationally?
It's interesting. I mean, you probably see there's some of the worst public health response on alcohol in countries like Scotland and Ireland. Um, in Canada, the that report from the CCSA, they actually suggested no more than 2 drinks per week to Health Canada, and Health Canada ignored it. So that was a good sign, right? They kind of saw it as a farce and let it fizzle. We have some of the positive development we already talked about in the US in terms of what is moderation and kind of relaxing that. Um, we'll see what happens in the rest of Europe. Some of it is some countries are understandably resistant to this kind of nanny state on alcohol because they have a very rich history of producing some of the best wines in the world, right? There's probably not going to be very much progress in France or Italy on this, just because the alcohol is cultural. It's something you enjoy with food, generally drank in moderation. So I think there's some hesitation from those countries as well. But where we go next is still to be determined. It really just depends. This is one of the holdovers of the pandemic is we put a lot of weight into public health agencies. And this isn't to like relitigate the pandemic in any way, but we did put a lot of weight in those public health agencies. And the the kind of takeaway from that for a variety of different reasons is I think a general cynicism towards those agencies and what they have to say. I use the example in Canada for the first 3 or 4 months of the pandemic. Health Canada said, don't buy masks, don't wear them, they're not going to work.
Mhm.
Then pivoted and said, actually, you do wear masks and you should have to wear them. And we got all these silly rules where you had to go into a restaurant wearing a mask, you could take it off to eat, put it back on to go. And everybody saw that as like a farce. And it really devalued the suggestions from the public health officials. And so I do think that there's a cynicism here. And the more these public health agencies overdo it, the more that cynicism is going to grow. And that is understandable, but that's a big problem because we should have some level of trust in these agencies in performing their core functions. But it seems like they've veered so far outside of the norm that there's just going to be more of that kind of looking upward at what is suggested and just shrugging your shoulders and being like, nah, you guys are
Mhm.
wrong all the time. So why do I care?
Yeah, I could definitely see that being the case. And one more angle here I think is interesting. So, we can compare how alcohol is regulated to other legal but regulated things, like tobacco, but also to previously illegal things like marijuana. And although again, in lots of places that is, uh, even for recreational use, is legal now, such as like the majority of U.S. states. Uh, I remember when I started working in Washington, D.C., working on stuff like this, now over 25 years ago, and there was so much anti smoking advocacy at the time. People said, "Oh, well, someday cigarettes will be illegal and marijuana will be legal everywhere." And people laughed and chuckled at what a ludicrous, ridiculous idea that would be. But it seems oddly moving in that direction, actually. Which is not a comment on their relative risks or advantages, but just sort of funny that is almost becoming the reality in some places. Um, but I wonder if this differential approach to, say, alcohol versus tobacco versus marijuana just shows that a lot of this policy isn't actually based on, or isn't, only based on sort of hard science of health risks. It's a sort of wider kind of like way we view society and way we think the sort of like distributional effects are on who smokes versus who drinks versus like who uses marijuana. Because some of this marijuana legalization policy in New York City, for example, has included the idea that like uh, marijuana shops should be licensed first to people from disadvantaged backgrounds. So,
Hmm.
which again, that obviously that doesn't have anything to do with the public health effects of or the human health effects of smoking or not smoking marijuana. That's part of like a much bigger kind of like multi-generational view of social justice. And so the idea that the regulation, at least some of the regulation of these substances, has to do with stuff that has nothing to do with public health, should maybe
Yeah.
give us pause when we think about all of the things that are supposedly justified as being about public health.
Yep. Well, and there's a huge level of cognitive dissonance in the world of policymakers on when they don't think prohibition works, right? Prohibition didn't work for alcohol. Everyone knows the lessons of that. Al Capone. It's cliche to talk about it now. Generally speaking, most politicians understand that prohibition for cannabis didn't work, and yet you can have left leaning or members of the Democratic Party acknowledging that cannabis prohibition didn't work and had a variety of awful consequences while pushing for things like a generational ban on tobacco products, which is prohibition but just grandfathered in.
Mm,
And when I have conversations with these people, it's like, sorry, what in the annals of history are you thinking you're going to be able to rewrite here? How all of a sudden does on one thing prohibition will work? Like, do you think grandfathering people out of consumption is just going to magically mean that prohibition works? No, of course not. It's ridiculous. And 2 months ago, on the floor of whatever state legislature you're in, um, you argued that prohibition didn't work for cannabis. And so, I mean, acknowledging that prohibition didn't work doesn't mean you're endorsing people to consume the product. It
mm,
just means you've realized the reality that the consequences of prohibition are far worse than the consequences of legalization.
right. All right. Well, there's a number of lessons here in our conversation that I think a lot of policymakers should learn. Um, well, this has been an excellent conversation. David, thank you so much. Before we go, please tell our listeners where they can find all of your excellent work out there on the internet.
Consumerchoicecenter.org. And you can also follow me on Twitter or X at Clement Liberty.
All right, excellent. Thanks again for being with
Th-
us.
Thank you.